Yes, welcome to my presentation. My name is Ashley T. Bolin. I will be giving a presentation on women's health, depression during pregnancy and the postpartum period for epidemiology NU 527 for Jacksonville State University. So the objectives for this lesson is to understand the disease process of depression as well as its impact on women during pregnancy and during the postpartum period, to discuss the 3 levels of prevention and how, as an advanced practice health nurse, you can exercise those roles within each level, to identify the importance of screening for depression during pregnancy and after delivery and the cost effectiveness of such screening, and to discuss the potential unintended consequences of screening, and first be able to identify how the benefits will outweigh the risk. So the population of interest. The population of interest is women's health. It's with a focus on depression during pregnancy and the postpartum period. The area of focus will include women that are pregnant and within their first year of delivery. These women will be comprised of all races and ages that live in or around the Jefferson County area, and they receive their care from obstetricians at St. Vincent's East in Birmingham, Alabama. So according to the most recent published statistics in 2016, there was 59,090 live births in the state of Alabama. And out of those 59,090 births, 8,650 actually occurred in Jefferson County, Alabama. So the prevalence of the issue of depression. So what is depression? Depression is classified as a major mood disorder that can cause feelings of intense sadness and can lead to an inability to perform activities of daily living. Depression during pregnancy can affect the mother's health, not only the mother's health, but also the development of her unborn baby, while postpartum depression can affect the bonding of mother to baby and lead to the inability of mother to care for baby. So during pregnancy, mothers can be so depressed they'll not eat, and their babies will be IUGR. And then once the baby is born, the mother won't bond with the baby correctly, and that baby can suffer from failure to thrive as well. Women during their reproductive ages are a greater risk for developing depression, but women that are pregnant are even at a greater risk due to the hormone and physiological changes that occur during pregnancy. Those hormone shifts put moms at a greater risk for developing depression. It's estimated that 23% of women experience pregnancy depression, and as much as 25% experience postpartum depression. So to me, 1 in 4 is a pretty high number. So levels of prevention. So primary prevention. This level looks at interventions geared at prevention of the disease. We're going to look at, as an advanced practice health nurse, what can we focus on towards establishing programs, education about depression, screening for depression, and support for these mothers that are, say, going through a hard time financially. They don't have the support at home. The father of the baby's not involved. So things that would put them at higher risk, that what we could do to support these mamas so that they don't actually experience pregnancy or postpartum depression. The levels of prevention for secondary prevention. So this is once the mother has already been diagnosed with prevention. It looks at interventions towards stopping the progression of the disease through early detection. So as an advanced practice health nurse, you're going to address this level through depression screenings, referral of positive screenings to psychotherapy and support groups, as well as prescribed antidepressant and antipsychotic medication regimens. So these moms have been diagnosed, and this advanced practice health nurse, she's going to look at ways to halt the progression of it, to detect it early, and to try to optimize health of mom and baby. Levels of prevention tertiary. So this is once the mom has been diagnosed, and we're going to stop further deterioration of patient. And we say patient, but we mean patients in this case because we have mama and baby. So as advanced practice health nurse, you're going to help these mothers that are suffering with pregnancy depression and postpartum depression receive the professional intervention they need. And this could be in form of psychotherapy, more frequent clinical visits to monitor the health of mother and infant, medications, antipsychotic, antidepressants, and enrollment in support groups. These mothers research has shown that support groups have greatly helped mothers suffering from depression. So the role of APHN. The role of the APHN within primary level is going to look and, like we said, establish education for pregnancy and postpartum depression at these visits, at these mothers' pregnancy visits, and elicit screening for depression using a standardized depression screening tool, and provide information on how to enroll in other groups. The APN within the secondary level prevention is going to look at early detection, screening these mothers to determine the level of depression and suggest possible treatments based on where their depression is, the level of it, and enrollment in a psychotherapy program along with support groups. And the role of the APN within the tertiary level, again, we're going to work to try to stop the deterioration of the mother due to her depression diagnosis. And this is going to be closely monitoring mother and infant at visits or within the home, ensuring that that infant is safe, the mother is safe, and focus on initiating like medication regimens and psychotherapy and support groups. So screening tests that the American College of Obstetricians and Gynecologists have recommended that healthcare professionals will screen every obstetrical patient at depression at least once during their pregnancy. And tools that they use that can be used is the patient health questionnaire. It's a multiple choice report questionnaire that can be administered by the professional or someone can take it themselves. And the Edinburgh postnatal depression scale. It's a 10-item questionnaire that's developed to help identify women who postpartum depression. Both of these are reliable and valid tests that are free of charge and can administered within the office setting during a regular visit. So, unintended consequences. There's no evidence that's been found that screening for depression is physically harmful. It is a quick process that can be done, like we said, within the office. There's no physical tests that have to be performed. Pretty much the mothers just ask questions and they answer. They're encouraged to answer as truthfully as possible. But unintended consequences of depression screening would include any stigma or distress associated with labeling and possible false positives that may lead to unnecessary antidepressant prescription. The mothers can be ashamed of feeling depressed. They think that since they're pregnant and they've had a baby, they shouldn't feel depressed. And so, or you might have someone that's just being overly, dramatic, and you get a false positive as an attention seeker, and they might be prescribed medications that don't need to be. But benefits far outweigh the risk due to possible prevention and early detection. It can lead to a greater infant-maternal bond and better growth and development of infant and overall mental health of mother. So the conclusion is depression is a major mood disorder that can affect anyone at any age, but pregnant women are at a higher risk due to the drastic changes in their hormones during pregnancy and postpartumly. There's 3 levels of prevention that the APHN can enact role, which they can provide education, elicit screening, and various treatment options that best benefit the patient at the level of depression that they are at. Screening for depression is beneficial and is recommended at least once during pregnancy, and it's easy, quick, and at no additional cost. The benefits of screening help optimize the health and well-being of mother and far outweigh the possible risk of false positives. So the reference I've used was the Alabama Center for Health Statistics, the American College of Obstetricians and Gynecologists, the Screening for Depression in Adults and Older Adults in Primary Care by O'Connor and Whitlock, Postpartum Support International, and also Stanhope M. and Lancaster. This concludes my presentation. I appreciate you listening and taking the time to follow my presentation, and I hope you have a wonderful day. Thank you. Bye-bye.